in the United States, tobacco control has been a major public health success. We don't think of it that way much, but it's on par with vaccinations in the lives that we've saved from our evidence-based tobacco control. We've had such dramatic declines in the smoking prevalence in this country in the past decades. But what you don't see when you look at this graph is that there are groups of people who live in our country who have not benefited from this, and they have not seen their smoking prevalence go down. And one of those groups are people with behavioral health diagnoses. And so if you look specifically at people with opioid addiction, smoking prevalence is estimated at about 90%. So another way to look at it is this. If these cigarettes represented all the cigarettes sold in the United States in any given year, almost half of them are bought by someone with a behavioral health, so someone who has a mental illness or a drug addiction. And for context, 1 in 5 Americans have a mental illness or drug addiction. Almost half of every cigarette sold in this country every year is to someone in this position. Another way to look at it, every year about 500,000 people in the United States die from their tobacco addiction. Half of those deaths are someone with a mental illness or a substance use disorder. So why? Why is the prevalence so high? It's because we have very persistent myths about smoking in behavioral health. We hear all the time that people with substance use disorders can't or don't want to quit smoking. We hear sometimes it's someone's only joy. We hear that it's the most effective way for stress, or we hear it's just not a priority for such a high-risk population. But we know now very clearly that those are all myths. So first of all, patients with substance use disorders do want to quit smoking. In most studies, it's around 80%. It's the exact same percentage as if you asked anyone who smoked in the general population. 80% of people say they wish they could quit, and it's no different. Smoking is still a high priority issue for patients with substance use disorders because this statistic is often not recognized, but people with an alcohol addiction are more likely in their life to die from a tobacco-related disease than an alcohol-related disease. And even among people with substance use disorders, people who smoke are 4 times more likely to die early. And smoking cessation leads to a decrease in anxiety. Now, most of you out there know the act of stopping smoking certainly is stressful. But if you look at people over time, people who do not smoke have lower anxiety levels overall. And smoking has many times over been shown to not really reduce your stress. And finally, we hear that if you try to ask someone to quit smoking who's in recovery, that they might relapse. And it's just not true. So quitting tobacco use during your substance use disorder treatment is linked to a 25% increase in that person's long-term sobriety. So SAMHSA, NIDA all endorse that we need to incorporate smoking cessation therapies into our treatment programs to make a difference. And now is a great time to be talking about this because it is Kick It Kentucky. It's ACS CAN's a week to raise awareness about smoking cessation services in Kentucky. And really good news is that Senate Bill 89 passed in the last session. So now all 7 of the FDA-approved smoking cessation medications are covered by insurance. So this is a great step in the right direction if you're working with clients who are trying to quit smoking. Again, ACS CAN is working with 23 other organizations to raise awareness about this important issue. And I just want to end with this ad. It's from the campaign, "Cigarettes Are My Greatest Enemy." And this person says, "I didn't survive drug and alcohol use so that I could die from lung cancer. I had to stop smoking." So for all of you who work in a behavioral health setting, you're not doing your patients or your clients justice if we do not have them able to have access to these evidence-based treatments. And if you have any questions, feel free to see me after or send me an email. Thank you.